Hello, everyone. It's Dr. Nirapundia. A lot of Golden State Warriors fans have questions about the ACL sprain that DeAnthony Melton suffered. Here's a quick breakdown of what an ACL sprain is and what the general workup and return to play timelines are. Now, taking it at a very basic level, the ACL is the anterior cruciate ligament. It basically helps to connect the tibia to the femur. And you can see this ligament here in this model. The ACL provides stability to the knee. So any degree of injury to that ACL can lead to pain, swelling, and feelings of instability. Now, a sprain is some degree of tearing of a ligament. A grade 1 sprain is basically stretching or microscopic tearing. A grade 2 injury is partial tearing of that ligament. A grade 3 injury is complete tearing of that ligament. Now, the best way you can differentiate out which of these is a combination of physical exam as well as MRI. An MRI will show how much inflammation or even degree of tearing there's in that ligament. It can help to differentiate out a grade 1, 2, or 3 injury. But it's important to understand that physical exam is really important as well, too. Sometimes an injury may look like a grade 2, but the knee feels very stable, and it may actually be a grade 1. Or sometimes something may look like a grade 1 on MRI, and actually the knee feels very unstable, or an athlete feels very unstable, and it can be a grade 2 or even grade 3 injury. Now, in terms of return to play for a grade 1 injury, which is basically microscopic injury to the ligament, typically you can get back to play when pain and swelling is resolved. There's not any other associated injuries that may have occurred with that sprain, and an athlete feels stable on the court and they have a stable physical exam. Grade 2 injuries become a little bit more difficult because you can have partial disruption of that ligament and you may feel very stable and the athlete may continue to play, or there can be a lot of instability and then the athlete needs to get surgery. Grade 3 injuries are complete tears, so those are the ones that typically will go on to surgery. The key is if this is just a simple sprain where there are intact fibers in that ACL and there may be some stretching or microscopic tearing, it's basically about how the knee responds, how it feels in terms of range of motion, pain, and swelling, and if an athlete can get on the court and the knee feels stable. If further tests show that there's more disruption of the ligament, that can mean extended time off, or in worst case, it can sometimes mean surgery as well, too. Thank you.